my father, and the recovery program and recovery people have been a part of my life since I was a small child. Because the recovery program has made a huge difference in the lives of just about everyone who has come in contact with it, I would like to talk a bit about how Abraham Lowe developed it and the difficulties he encountered in trying to get it recognized as a valuable system of self-help in the mental health field. Abraham Lowe's original field of medical study was actually neurology. He came to the University of Illinois College of Medicine in 1925, and for the next several years he did research in neurology. Then in 1931, the Psychiatric Institute was opened in the College of Medicine to do research on patients with various mental illnesses. The patients were selected from hospitals around the state and brought to the Psychiatric Institute for treatment. The head of the institute knew of the research work of Abraham Lowe and wanted him to develop medical research at the Psychiatric Institute. He was innovative from the start. He knew that psychoanalysis, the prevailing treatment at that time for mental illness, couldn't work with so many patients, and he didn't believe its concepts and treatment methods were effective. He realized that with so many patients at the Institute, rather than always dealing with them individually, he could treat more of the less severe ones by meeting with them collectively. Thus, he started an early form of group psychotherapy. He also knew that lecturing the patients wouldn't work well, but interviewing one and then giving an explanation while the others listened could be effective. He strongly believed in the power of words and always kept his interviews and explanations very simple so that his patients could grasp the concepts. He was innovative with the treatment of the severely mentally ill as well. He introduced shock treatments at the Psychiatric Institute, and the dramatic improvements which resulted enabled him to treat those patients with the same techniques he used on his less severe patients. It also convinced him, more than ever, that psychoanalysis was not the path to follow. Unfortunately, the psychoanalysts resented his theories and methods of treatment, and thus began a rift between Abraham Lowe and the well-entrenched psychoanalysts that became more predominant as years went on. There also was another problem. Lowe's patients were improving and being released from the hospital, which made other patients in the hospital want to become his patients. And as you can imagine, the other psychiatrists were not pleased. As Lowe's patients continued to improve and be released from the hospital, it became evident that life outside the hospital was very difficult. The stigma of mental illness prevented them from communicating with other people, being able to get jobs, and even reintegrating back into their families. In the fall of 1937, several of Abraham Lowe's former patients came to him asking for help in dealing with the stigma. He set up a meeting for them for November 7th in 1937, and that was what was to become the Recovery Organization. The organization at that point was intended to serve three purposes. Patients could talk freely with each other and share experiences. Dr. Lowe could observe their progress, and they all hoped in some way to educate the public about mental illness and eradicate the stigma. One thing that recovery members missed when they came back to the hospital for meetings was the group psychotherapy they had experienced when they were in the hospital. So Dr. Lowe set aside time to periodically conduct psychotherapy sessions for them in the Psychiatric Institute. His dream was to have recovery groups established in all state hospitals across the country. But it was not to be, because the psychiatric profession continued to reject his concepts and methods of treatment. By the summer of 1941, the gulf between Abraham Lowe and the psychiatric profession had widened so much that recovery was forced to leave the Psychiatric Institute and move to downtown Chicago. After that, it was really the recovery members who were instrumental in growing the organization. First, it grew by word of mouth, then it started getting publicity, and eventually the organization spread throughout the United States, Canada, Puerto Rico, and abroad. As recovery expanded, Abraham Lowe worked on developing a structured meeting format that could be used by recovery groups anywhere. In 1952, he finalized that format and then turned the recovery organization over to the patients as a truly self-help organization. As I said before, Abraham Lowe's dream was that there would be a recovery group in every state hospital in the United States, as well as recovery groups in communities across the country that former patients could access once they were released. This would be instrumental in preventing relapses. Oregon State Hospital is fulfilling that dream, and hopefully more state hospitals will do the same. It's a joy to be here and see the amazing job you are doing with the Abraham Lowe self-help system. I know he would be extremely gratified with your dedication to this program. It's an honor for me to be here, and I thank you so much for all that you are doing.